Outdated psychiatric medical procedures that are no longer used. Let's go. Lobotomy. Have you ever tried to fix a watch with a sledgehammer? How'd that go? That's basically how gentle a lobotomy is. The sledgehammer is going to stop that neurotic ticking all right, but the watch doesn't work so great anymore. The lobotomy consisted of a doctor drilling holes into the patient's skull to unplug the rest of the brain from the prefrontal lobe. The thought was doing so would relieve unwanted depression, psychotic, or violent behaviors. Essentially, it was a quick-fix solution that left the brain like scrambled eggs. Who needs emotions or critical thinking when you could just slice and dice? Not surprisingly, the results were very hit and miss. While the first lobotomy ever performed with a drill was deemed a success, few of the patients were so lucky. And to be clear, some lobotomies were performed without anesthesia, with ice pick-looking devices. Pause. Who else thinks that while using the ice pick method, a doctor's hand might have gone a little too far? By many accounts, patients and even Kennedy's oldest daughter, Rosemary, ended up somewhere too far on the road to a persistent vegetative state. The lobotomy era lasted from the 1880s to 1967, when the last recorded lobotomy was performed in the United States. Ever wonder if the expression, "I need it like a hole in the head," could have been inspired by the lobotomy? Straitjackets. We've all seen a straitjacket in TV and movies. They don't exactly have the best reputation. They're like fashion statements from a horror movie. Essentially, a white coat with super long sleeves. Tie them behind a person's back, and the person in the coat can't move their arms. It's like a mandatory hug. Who wants a jacket that hugs you harder than your ex on Valentine's Day? These coats were generally used in asylums and prisons during the 1800s to restrain people. Plenty of injuries and death have happened to people while straitjacketed. Keep in mind that while wearing it, only Houdini could escape. People wearing it weren't exactly supervised or treated well. It was not uncommon to find someone strangled. While initially deemed helpful and even more humane, of course by the people using them, straitjackets quickly became a crutch for many hospitals. Overpopulated and understaffed, prisons and psychiatric hospitals would strap these on more and more patients. Eventually, the public caught on and agreed it was inhumane to force someone to play a never-ending game of Twister with themselves. Asylums. Asylums, where sanity takes a vacation and chaos checks in for an extended stay. They were a product of the medieval era that never really evolved. The goal? To house, cure, and help the mentally ill. The reality, they were basically warehouses, used to store people that society deemed mentally unfit and needed to be separated from the herd. Some weren't even mentally ill at all, more so inconvenient. Perhaps it's the 1800s, and you are a rich man who wants a new wife. All you had to do was have a doctor sign a letter that she was hysterical, which was a term for women that were essentially opinionated. Now she can be put away permanently, and you got to divorce. Asylums were overcrowded, sometimes holding 4 times more people than they were designed for. In overpopulated, unsanitary conditions, diseases ran rampant. They were also largely unmonitored realms of human experiment and torture under the guise of psychiatric care. No one really knew what they were doing, so they were winging it in the worst way. Hearing voices? Maybe you need to be dunked in some freezing water. Too depressed? Lobotomy. Maybe we see what this ice pick in your brain might do. How about spinning you in a circle really fast until you pass out? See if that makes you less anxious. Consent? What's that? You don't like what we're doing? Try this straitjacket. Due to their lack of oversight, some drug companies use the inmates as unwitting test subjects. As word got out of the inhumane conditions, many were shut down. Though, thankfully, many legitimate psychiatric care facilities were born from their ashes. Hysteria Therapy. Female hysteria was a common but widely spreading ailment during the 1800s. Common symptoms included anxiety, bloated stomach, irritability, and sexual desire. By today's standards, it was a made-up illness by doctors who didn't understand women. For the most part, if a woman dared to have an opinion that differed from her husband's, she could be diagnosed with this ailment. But don't worry, there was a cure. To alleviate women of this condition, doctors would conduct thorough pelvic exams on their patients. Now, before you get all weird about it, these doctors only performed these exams until their female patients achieved hysterical paroxysm, which was supposed to alleviate the patient's hysteria. We now just refer to this as the Big O. Well, of course, some docs probably did this just because they were dirty birds. But eventually, requests for this procedure got so high that doctors couldn't keep up with demands. Because, after all, every woman wants to achieve multiple hysterical paroxysms. So, Dr. Joseph Mortimer Granville created an electromechanical medical instrument, aka a vibrator, so women would conduct this treatment themselves. As they say, if you want a job done right, you gotta do it yourself. Insulin coma therapy. Back in the day, schizophrenia was sometimes treated with a thing called insulin shock therapy. So let's run through this. The patient is hearing voices, seeing things, and is generally scared. So the patient would be injected with enough insulin to knock them into a coma for about an hour. Basically, something like rebooting a glitching computer. You see, at high doses, insulin causes a person's blood sugar to drop precipitously and knock them out. Amazingly, insulin shock therapy was said to have an 80% success rate, but it also came with a lot of risk. Typically, when someone would wake up from a coma, they would be restless and prone to aftershocks. In extreme cases, patients would die or suffer brain damage as a result of being in a coma for too long. Despite the touted success rate, the high risk to patients' health caused insulin shock therapy to be phased out. Bloodletting. For thousands of years, one of the most common medical procedures was known as bloodletting. During this procedure, a major vein in the patient would be sliced open to release as much blood as possible, sometimes for days at a time. Other times, doctors used leeches to draw the blood. The goal was to expel bad blood from the body, which was believed to be the cause of almost every ailment. Bloodletting was used to treat diseases like mental illness, smallpox, epilepsy, and even the plague. And the amount of blood pulled out of a person varied. In one case, doctors bled a French soldier of over 5 liters during a month to save his life. At one point, he had over 50 leeches on him. However, things don't always go so well. For example, in 17th century France, Dr. Jacques Ferrand treated heartbreak with bloodletting. His theory? To achieve cure by bleeding the heart broken to the point of heart failure. And opening hemorrhoids was the surest way to achieve great success. Other times, patients suffering from mania were bled to achieve a calm disposition, which in modern terms equates to suffering from severe anemia. Surgery. In medicine, if a body part, like a limb, is badly infected, it's sometimes amputated. That worked great for a rotting limb on the Civil War battlefield. Not so good when it comes to mental health. To this point, in the early 1900s, a similar technique was applied to mental illness. I know what you're thinking, and no one's brain was removed. Probably. However, in place of that, sometimes bits and pieces would be removed to see if that's what was making them crazy. Maybe let's start with a rotten tooth. No more crazy tooth, no more manic episodes, right? However, as shocking as it may be, that didn't work. So the medical Russian roulette continued. The tonsils are nearby. Let's try that. Then it only escalated. For instance, in his own attempt to alleviate mental health problems, Dr. Henry A. Cotton removed people's testicles, ovaries, uteruses, or uteri, if you will, gallbladders, stomachs, and colons, which just seems like a crappy thing to do. As you can probably imagine, a major drawback to all these surgeries was a lot of dead patients. How many? Well, it's been estimated that around 45% of his patients died following surgery. For the record, that is a very high number that no surgeon should hit. This was largely due to the fact that antibiotics weren't a thing, and the sanitary conditions were questionable at best. Lesson learned? Mental health is not a game of organ whack-a-mole with other people's organs. ECT, or shock therapy. Electroconvulsive therapy, better known as shock therapy, is a medical procedure that involves attaching electrical nodes over the temples to send bursts of electricity to the brain. These bursts of electricity cause the patient's body to convulse or shake wildly for a few seconds. This is an example of a medical therapy that reboots the patient's brain like a computer. Though it sounds like a form of torture, the goal behind the treatment is to help those suffering from some forms of mental illness, like severe depression. While the first successful human trial for ECT was performed in the 1930s, Versions of this procedure date back to the 1700s. Thankfully, things have become much more humane for patients since then. One of the biggest problems with this medical procedure was that in many cases, it was performed on patients in mental asylums without the patient's consent. Initially, one of the upsides to shock therapy was that it caused short-term amnesia. Why is that good? Well, put it this way. If you had just been electrocuted to the point where your entire body shook violently, would you really want to remember it? With the rise of things like antidepressants and advancement in mental health, the use of ECT has been dramatically scaled back over the years. Surprisingly, it still has a place in the toolbox of medicine for some severe cases of depression. It's more of a last resort, and it's done under anesthesia with consent. Hydrotherapy. Hearing the word hydrotherapy might conjure up images of someone either relaxing in a jacuzzi or chilling out in a sauna. The fact is that, for a time, it was much more intense. When applied to treating mental disorders, early psychiatrists used extreme methods in a bid to cure their patients. These included plunging a patient into an ice-cold bath for hours at a time. Today, some pro athletes use ice bath as a form of physiotherapy, but it's nowhere near as tolerable when it's forced on a person. Win Huff, the famous Iceman of our day, wasn't there coaching anyone, and no consent was obtained. Patients experiencing mental illness were often strapped in and endured forced cold plunges. Other times, they were wrapped like mummies in ice-cold towels. Sometimes the staff just started spraying the patient with high-pressure cold water from a hose. Nowadays, some people use cold therapy to stimulate their body to adapt. Medical research has not shown a benefit in treating mental illness, but it can be used to stimulate the body to heal.